So I'd like to talk about a set of procedures that I offer that you may or may not be familiar with called facial feminization. So I want to talk about the procedures and what they all involve and what my philosophy is on each part of it. So facial feminization is a little bit different than our typical facial rejuvenation procedures. It's not necessarily making someone look younger, even though that might be part of it, but it's more feminizing than anything. So it's taking those masculine features and making them look feminine. So it really requires a great eye and understanding the difference between male and female faces. I think everybody can tell the difference between it. We know what a male face looks like and we know what a female face looks like, but not everyone can tell you why that face looks female or why that face looks male. So I'm just going to start from top to bottom and talk about the different procedures that I offer. So the first procedure is forehead shortening. So that's the number one thing with the difference between male and female, is that female hairline, or the feminine hairline, is much lower and rounded, and the male hairline tends to have temporal recession. And what that means is just, even without balding, there's a little bit of loss on the sides. And then of course, if there's male pattern hair loss, you're going to have receding hairline on top of that in the front. So the goal is to remove forehead skin and bring that scalp forward. The next part is going to be a brow lift. So the female eyebrows are somewhat arched, and the arch is right around the temporal line, which is right here. So the arch comes right there, just above the actual brow bone. And the male brow, more times than not, is pretty flat and straight, and the brow sits right at the bone. So the goal is to give it that nice subtle arch, but it's still noticeably different from man to woman. And then the next part is going to be blepharoplasty. And that's mainly for rejuvenation, but also you can create a more feminine look by changing the amount of skin and how full the upper eyelid skin is, and then the lower lid skin, you want to make that as smooth as possible as well. The next thing, which I think is really fascinating, is rhinoplasty. So what's the difference between the male nose and the female nose? So the goal of a feminizing rhinoplasty is to create a more delicate nose, and B, to create a more upturned nose. So the female nose always has a little bit more of an upturn compared to the male nose, and it's a little bit narrower. So basically it's a reductive rhinoplasty. Now everybody's different, and there are of course ethnic differences, and you always want to preserve the ethnic quality of the nose and have the nose fit the face. But again, the goal is to create a smaller, more upturned nose. And then lip lift. Lip lift can be done in conjunction with rhinoplasty, but I usually do them as separate procedures because the incisions are so close together. So the lip lift involves removing skin of the upper white lip just below the nose. You hide the incisions around the nose, and then you pull up the red lip to give more show. The next part would be a neck lift. So this is pretty much more like a rejuvenating procedure. You just want to create a nice jawline and a nice slim neck. Now, part of the jaw feminization involves bone work. So that's going to be chin reduction and jaw reduction. So that's going to be thinning out this part of the jaw right here. And so that's done either through incision outside the neck or inside the mouth, just depending on what other kind of procedure is being done at that point in time. And including that kind of bone work, there's also bone work on the forehead, and that's going to be brow reduction. So on top of the lift that I mentioned earlier, the brow reduction involves burring down the bone. As you can imagine, the male brow bone is stronger and heavier, so you want to create it from a heavier brow to a rounder, more lifted brow. And that's done under the skin with a burr to burr down the actual bone. The problem is you have what's called the frontal sinuses just below that. So if the frontal sinus is very large, the bone is going to be thin, so you may have to have an additional procedure along with the burring in order to shorten and thin out the forehead. And that's basically all the different procedures that are involved in facial feminization, and it just depends on the age of the patient and what their particular features are and what their desires are to get them into a more feminine appearance from where they're starting.